what really happens between the TGNC community, and what are some issues that we know the TGNC community experiences within the healthcare system?
I think the biggest thing that we need to work on is affirming care from your time in the first door through your entire experience. Because everyone that works in the hospital system, whether they're the janitor, registration, your doctor, your nurse, the person coming to clean the trash bin, everybody should be affirming of a person's identity from start to finish.
I always say it's all about education. If you're gonna be providing services to a particular community like the trans TGNC community, then educate yourself and educate staff. I shouldn't have to go to my doctor who has this degree and PhD in endocrinology and give them an education and crash course on what I need.
It's really hard to be sick or be in a situation where you're not already at your best and then have to educate on top of not feeling well, on top of like you're there for a very specific reason, and then to have to give basically the trans 101 when you're sick. Nobody has the energy for that.
It's embarrassing, and as we spoke earlier, it can get a little violent because it's like you automatically turn into that little kid in school when the teacher calls out on you to read, and you're scared to read because you feel like you're not a good reader, so you start acting out. You're the class clown. That's literally what happens. We're embarrassed, and we need to respond in a way. Some of us respond very belligerent, very with anger. That ultimately just is a domino effect, right? It causes us to stay home, not to come to our appointments, not to do the things that we need to do to keep ourselves healthy.
Yeah.
That's how I feel too, because when I call and make an appointment, they make me feel uncomfortable because they keep bringing up my own name. And it's very uncomfortable for me, and it hurts me, and I know how I am. I'm quick to flip, and then I know sometimes you cannot flip because, mental illness, the first thing they's like, oh, she's having a mental illness problem now, so we're going to need to put her away. But no, it's the way you talk to me, and, I present myself one way, and you calling me a whole different thing. I feel it's not right.
But
Yeah.
you know what? Again, it goes back to what you're there for.
Mm-hmm.
That's why it's necessary that some sort of dialogue is that there is no hello ma'am, hello sir. It's may I help you?
Yes.
Do you have an appointment? And that should be it.
I'm interested to sort of like use this time to talk a little bit about kind of like our vision for what trans-affirming healthcare, real trans-affirming healthcare looks like. But before we do that, I actually want to invite the public advocate to speak because I think that he's vitally important for this portion of our conversation. Mr. PA,
Peace and blessings, everybody.
listen, he brought his own chair, y'all. What does adequate, real, trans-affirming healthcare looks like? How do our city and state leaders get us there?
Whether I'm in Staten Island or Far Rockaway, or whether I'm in Brooklyn or in the Bronx, I should get care across the spectrum. And we have to make sure that once that is put into effect, we have to make sure that accountability is there. Because it's one thing to make it a law, and it's another thing to follow through and make sure we're holding people accountable.
Exactly.
And I think we have to, again, create a space where we can come to the table to discuss what needs to be brought to the table.
Representation is everything because you put in these grants, you put in whatever it is these doctors apply for, and to bring this money in, but you don't have no representation on your staff. So how you even know about a community that you are applying for to provide them services and you don't have representation?
But I think we have to also challenge, the higher structure, because we have to look at the way, physicians are taught. And if you look at the average education component, they get less than 6 hours throughout their whole medical training on transgender individuals.
Yes.
So that is not a lot of training to be able to provide adequate care to individuals.
You know how many people have doctors that constantly, a year goes by, a year and a half, or 2 years, whatever, and they're constantly getting switched, a new doctor, because that doctor left. They have a new doctor, they have a new nurse, they have a new patient. It's like that and having to relive the trauma of having to explain and trying to connect with that doctor and let that doctor know all your business and stability is what's really needed.
We need to make sure that if I'm going to Woodhull and then I want to go to NYU, we need to make sure that the electronic medical records go with those individuals. So it shouldn't be over because this hospital has more money. They have a better medical records keeping system, and that's not fair for some of us who, again, live in some areas where we might not always want to travel an hour and 30 minutes to get to the best institution. We want to get that care within our own neighborhood. So no, it's not that I need anything special, but I do need stuff that is tailored.
But Mr. Williams, I'm going to charge you to advocate on our behalf. Yes, this is good having a roundtable discussion, but whoever the next mayor that is coming in, you need to advocate that there needs to be one of us on the staff. Or someone that looks like us on the staff. Because we are the ones, we are what we've always needed. We never needed someone to save us. We just needed the playing field to be leveraged so that we can create those measures to sustain ourselves.
All of the hospitals should be laying out how to provide health care that's equitable, that's just, so that people don't get re-traumatized. Yeah. It's simple about, genuinely. Yeah. How do we give getting a report? I don't want to have to getting a report of how the hospital is moving to make sure that they're training people to provide these services. And I guess what we call this Bill of Rights for communities, which obviously is just a step.
Yeah. We need a shift in language. One, I think there needs to be we also need a shift in how we collect data. We also need a shift in how we manage our electronic medical records. Right? We need a shift in how we are being trained and how we receive training, and therefore how we produce or provide service as people who are providing service. Every single one of us, right? Particularly in a very important space as the healthcare system that every single body throughout the course of their lives will access. For some people less so because of these experiences and because of these gaps. Yes. Thank you all.